And joining me now is Dr. Pierre Wolkenstein, the head of medicine at Paris East University. Doctor, thanks for your time. The government is clearly racing to relieve pressure on overwhelmed hospitals in the east of the country by transferring patients to other parts of France. I assume we're going to be seeing much more of this as the weeks continue.
Oh, yes, of course. The wave is there. So during the weekend, it was clearly something that was a kind of disaster in greater Paris region. So I think that the policy and the strategy will be to organize a massive transfer in order to have ICU beds.
How long will it take before the lockdown actually starts having an impact on those figures?
I think it's written that it is 14 days, so we should have the results today or tomorrow.
But do you think, given what's been happening in Italy and Spain, especially in Italy where they've been in lockdown for more than 3 weeks and are still registering record figures, that actually is going to take quite a bit longer?
So when you are looking at the curves, we are have exactly the same curves as in Italy. So I fear that it will not be sufficient for the next 15 days. So my fear is that we will follow Italian people.
In that case, how long do you see this going on?
I do not know. If I knew, it would be great, but I do not know.
Finally, Dr. Wolkenstein, France prides itself on its robust healthcare system, but this pandemic is testing it as it is with other countries. What will it take to ensure that the healthcare system in this country does not collapse?
Nothing. It's not possible to know, but today we increase considerably the percentage of ICU beds, but the problem will be manpower. To have rooms, to have respirators, to have masks, it will not be a problem in a few days, but the problem will be, of course, behind that, nurses, doctors, students, and so on.
Dr. Wolkenstein, thank you so much for your time.